All right, good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton, Montgomery County. Thank you for being here today to where we can provide an update to our community on our response actions to this COVID-19 pandemic. We're very fortunate again today to have Mayor Dan Whaley from the City of Dayton. We also have Tracy Clare, our Emergency Preparedness Planning and Training Specialist, who's going to talk to us a little bit about cloth masks. We will have Sarah Hackenbrack from the Greater Dayton Area Hospital Association, and then Dr. Michael Doan from Public Health, our Medical Director. So we've been talking at length over the past several weeks about flattening the curve and what we need to do as a community to be in a position, as well as a state, to consider reopening and then moving into a recovery phase. And we all understand that we need to see a reduction in cases multiple days in a row. We need adequate testing capability. We need adequate personal protective equipment for first responders, healthcare workers, and others. We need to assure that we have the capacity we need within our hospitals, and we've received very encouraging information recently from Sarah Hackenbrack regarding that capacity. And then we have to make sure that public health continues to do contact tracing. We identify ill individuals and close contacts, and we make sure that they're either isolated or quarantined. And I think we all understand that responding to this pandemic has been very challenging. We have no immunity. There is no vaccine. Limited treatment available other than supportive care. It's a highly transmissible virus, and individuals who do not show symptoms can spread the virus. Those make managing this response very difficult. And so in the absence of those previous items, what we do as a health department, as a system of partners, as a healthcare system, as organizations, both public and private sector, is we apply the evidence base that's available to us. So you've heard Dr. Acton from the Ohio Department of Health speak before about we would use a layered, multifaceted approach to respond. And so that's what we've done. And I think it's important that we all reflect upon the accomplishments we've made as a community. So certainly the message of prevention can never be lost, and we can never say it enough. Let's make sure we're washing our hands, we're covering our coughs and sneezes. We're staying home when sick. That's really important. We should not be leaving home if we're feeling ill. Let's make sure we don't touch our face, again, because we know how the virus spreads. But then we had to get into, as a state and as a community, more difficult decisions that move beyond prevention. And that's where very difficult decisions needed to be made. And so you started to see at the state level, then we began to cancel mass gatherings, or we required restaurants and bars carry out and delivery only. Closing of schools and colleges and universities, and placing visitor restrictions at high-risk facilities. And then the stay-at-home order and closing essential business or non-essential businesses and operations. Allowing essential businesses to continue to operate, but requiring them to do certain actions as well to protect their employees as they operate, such as teleworking, as well as virtual meetings, and then mandatory social distancing within the workplace. All of those things help us as a community and as a state to slow the spread of this virus. And so one additional tool, and we've talked about it previously, is the use of a cloth face mask. And I think it's important to revisit why that's being recommended. Certainly the Centers for Disease Control and Prevention and the Ohio Department of Health, as well as Public Health Dayton and Montgomery County, are recommending the use of a cloth face mask. No, it's not for very young children. Children under age 2 should not be wearing a face mask. Also, any individual who has breathing difficulties, no, you should not wear a cloth face mask. Let's use common sense there. I think we're going to start seeing more and more states actually making it mandatory that individuals wear a cloth face mask. And we've heard today that New York as well as Maryland are making those mandatory. It's important to remember that the cloth face mask is not a substitute for social distancing. So we still have to continue this stay-at-home order as we further flatten this curve. The cloth face mask doesn't It doesn't prevent infection from the virus. But what it does do, because we know we shed the virus through our mouth, through our nose, through breathing, individuals who may be asymptomatic, carrying the virus, just in normal conversation, can potentially spread it. And so all of us wearing a face mask, we're much less likely to shed that virus, and it becomes less airborne. And we have less droplet spread. So it's becoming more and more of a recommendation across this country that we should be wearing a cloth face mask. There are a lot of videos online as to how to make a cloth face mask, and then we're going to actually have one of our presenters today, Tracy Clare, kind of walk through that as well to give us more information. So with that, I would like to welcome Nan Whaley to the podium.
Thank you, Commissioner. Thanks for your great work, as usual. We'll be very, very brief today. Appreciate Dr. Dona coming on again on Facebook today to do The Doctor Is In. Had some good conversation and good information about how we're doing in Montgomery County, particularly the issue we have with racial disparity that we talk about regularly here and across the community. Want to talk a little bit today about the challenges we're seeing as Helen Jones Kelly came Friday, discussed our opioid rise and accidental overdose deaths. And so want to encourage, as we continue to do our harm reduction work across the city and the county with syringe needle exchange and other efforts, the opportunity to make sure that you're carrying Narcan, and then encourage people that must use to not do that alone, to make sure they have someone with them that is carrying naloxone, that it is incredibly dangerous. We know people are addicted during this time. We see this increase to be very troubling, and our goal through all of this, from COVID to addiction issues, is to keep people alive during this time. So please, I'm encouraging folks to have a buddy to make sure that you have someone that has naloxone, because this is very dangerous, and we want you to stay as safe as possible. Thanks, Commissioner.
Next, we have Tracy Clare, Public Health Planning and Training Specialist.
Sounds fancy when you say it. I know. It is. I decided I'll bring visuals. So when they asked me to come up and talk about this, the masks, I realized that we had to start with, we have a number of N95s that we needed to get back out into the public. In order to do that, I had to reach out to volunteers and say, can you help us sew? And we started buying elastic in hopes that we could start getting these N95s out on the street. And we had sewers come out of the woodwork. They are all amazing because they all agreed to help us with this problem. So by removing all of the old elastic that breaks and putting new elastic on, we will put masks back out into our first responders' hands. And I'm very excited about that. The biggest problem we are facing right now is that we need elastic. Because we are all doing wonderful jobs creating masks for everybody, we are in the queue for elastic. So one of the things we are asking is if people are willing to donate some elastic to get first responders N95s in their hands, we would be very grateful. You can donate those at 945 Edwin C. Moses Boulevard at the thrift store entrance, and we will use that elastic to get it out to our sewers in order to improve our opportunity for our medical people to continue doing their jobs well. Now, with that being said, we had to come up with a way to do masks without elastic. So we came up with this design, very easy, very adjustable. Obviously, you saw me wear mine. That we can use so that we can still try and leverage the elastic that we are being donated. I have a sample of how they're put together. The best part of this project is from here to here. Your machine can be grandma's, 1923 machine, your mother's 1950 machine, or your brand new machine. All of them do a straight stitch, and that is all this requires. So if anybody is interested in sewing these, we are making kits, 10 each for these. These masks will be of benefit to our first responders, law enforcement, fire EMS, long-term care facilities, hospitals, and others, in order for them to put on people who may be riding along, who may be in an ambulance, who may be coming in and checking in at a hospital entrance. These masks will be given out to those folks. We are making kits in packs of 10, so every time you grab a kit and can sew 10, that's 10 people we put a mask on in our county. Lastly, the no-sew mask. These are just t-shirts. I got some t-shirts donated. These masks can be used in places like buses, or they can be in places like your store or anywhere else where somebody may not have a mask, they don't feel comfortable, or you think they should have one. It's just a t-shirt, but it still does the full coverage that we need. So the idea behind all of these masks is, as Jeff said, the opportunity not only to make sure that we keep each other safe by not causing problems, but also with these masks, it's attempting to get these back out into our health and medical providers' hands so that they can continue to keep us safe here in Montgomery County. Thank you. I'll walk this way so I don't trip. Thank you, sir. Thank you. Thank you. Is that okay?
I'd like to welcome, thank you, Tracy. I'd like to welcome Sarah Hackenbrack to the podium.
Thank you, Commissioner Cooper. Thank you, Mayor Whaley. Tracy, thank you for your partnership and your leadership on the creation of the masks. Tracy has been a huge asset to our team as we've learned, some of our N95 masks did need repaired with our hospital partners, and so helping us find those coordinated sewers who have the ability to help us repair those masks and get them back out to our healthcare providers, and then partner to make sure that all of our partners in nursing homes, hospitals, first responders, and fire, police, and EMS also have the cloth masks available. This has just been a fantastic community partnership and effort. So this afternoon we did get some positive news from the governor in that he is looking forward to some planning efforts with the Ohio hospitals across the state to really start to look at how we can reinstitute elective surgeries here in the state of Ohio. And when you think of elective surgeries, I know many people immediately think that that's something that's non-essential, that might be something like cosmetic surgery, but I challenge you to think of maybe some of our littlest patients, and those may be children who have had to delay getting tubes in their ears or having their tonsils removed. So those are the types of surgeries that our hospitals are really eager to get restarted. And in the ask from the governor, we've also been challenged to remember that we are challenged by limitations on PPE, and we are continuously challenged on the limitations for testing in the state of Ohio. Testing remains top of mind for our region's hospitals, and we continue to look at how we can innovate and be creative and partner here in the Dayton region. And so some of our hospital partners have developed the ability to do rapid testing here in the Dayton region, but we are still limited on that rapid testing and on the ability to do more testing for our frontline healthcare workers and patients as well as first responders, because we are limited on the supplies and the material that it actually takes to do the testing. So those are the swabs, the viral media kits, so those are the tubes with the solution inside of them, and then the reagent so that we can actually test the materials that's collected on the swabs. Still within this community, testing has to be done and ordered by a doctor. And then finally, within the state of Ohio, we're also coordinating with the Ohio Department of Health and following the guidance from ODH as well as the CDC to make sure that when we look at the limitations on our testing capacity, we prioritize those patients that are hospitalized and showing symptoms of COVID-19, as well as our frontline healthcare workers, those working in the inpatient areas of our hospitals, and then our skilled nursing facilities and nursing homes, those patients and employees. And then the third priority category or area, again, are our first responders, those other individuals who are connected right to our healthcare systems and are responsible for bringing many patients to us in a crisis or emergency and making sure that they have the ability to get tested quickly here in our community. So we look forward to continue to work with the Ohio Department of Health and Governor DeWine's staff, as well as his leadership, to make sure that we can get the rapid testing deployed here in our region. Thank you.
Thank you, Sarah. Also, thank you again, Tracy. Tracy wanted us to know that the mask videos will be available on Public Health's website at phdmc.org later today. Thanks again, Tracy. And next, I know, Dr. Michael Doan.
Good afternoon. I'm Dr. Michael Doan, a medical director at Public Health, Dayton, Montgomery County. Sarah Hockenbrock just finished talking about testing. I'm going to talk about testing results just a little bit. When one of those test results comes back positive, that is what's known officially as a Category A disease, which means it has to be reported to Public Health within 24 hours. The people I'd like to address are the essential businesses that are open, okay? Generally, we're going to get a report from perhaps the provider that ordered that test. We may get a report from the lab that ordered that test. If you have an employee or somebody on your staff that you find out has a positive test, you're certainly free to call us as well. The order actually says that physicians have to report it, providers have to report it, labs have to report it, and any person who knows about it has to report it. So we're not requiring you to, but give us a call. If it's a situation where you need somebody to talk to about how do you go about telling the other employees, we can talk to your HR people, we can talk to your employee relations people, we can talk to your public information officer if it's something that is going to be made public in a wider sphere. We can certainly talk to you about how to position that test result and how to reassure your employees and what we may need to do as far as talking to those that might have been exposed in the workplace. We want to be helpful with that, so that don't hesitate to give us a call. We want to make sure that especially our essential businesses are able to cope with this and to keep going and not have a situation where you have one person that's sick and then you have another person that's sick and that somehow it spreads before we kind of know about it and can catch it. So give us a call if you have any questions about that, and we're here to help with those kinds of difficulties. Thank you.
All right. Are there any questions? Anyone on the telephone line have a question?
Yeah, this is Drew from Channel 7. I just had a question for Sarah with Kadaha.
Hold on just a minute. She's coming back.
Drew, was that your voice that I heard?
Yes.
It was. Good afternoon. How are you?
I'm good. How are you doing?
I am good. I just had a question. You touched on it a bit with the appointments and things like that, the governor talking about that today. I wanted to ask specifically about visitor restrictions. Myself included, there are some people out there that are expecting parents that may be wondering, will grandparents be able to visit their newborn? In other situations at the hospital where visitors might be able to, come and visit their loved one as part of that as well. Has there been any discussion on when we might see some of those visitor restrictions relaxed a little bit, and where do we stand with that?
So the question was, where do we stand on the current visitor restrictions policy for the region, and if there is going to be a relaxing of those in the region? So Drew, certainly we recognize that, especially for expectant parents and then for families experiencing major surgeries and other situations, that the visitor restrictions are significantly challenging. And this is an opportunity for us to continue to protect the safety of our patients and our care in our hospitals, and to continue to address the needs to make sure that we're taking care of our frontline healthcare workers as well. And so at this point, the visitor restrictions policies are set to be in place until the governor's state of emergency is lifted. And that has been an agreement among our member hospitals across the region. We will continue to revisit these questions, and we have conversations twice a week with our board CEOs, as well as our COVID-19 task force and the clinical leadership. And so please know that we do not take the decision for visitor restrictions lightly, but it truly is a measure of safety for our region's hospitals to make sure that we're taking care of you and your family when you are in our care, as well as everyone else in the community that our hospitals are responsible for.